Hi everyone, my name is Dominique Richardson and I will be presenting on the epidemiological study on dengue in southern Brazil under the perspective of climate and poverty. For starters, I would like to cover what is dengue virus, how is it transmitted, what are some symptoms, treatment options, as well as who is at risk. So, dengue is a vector-borne viral infection that is caused by four different serotypes: dengue virus 1, 2, 3, and 4. And it is mainly found in tropical and subtropical climates worldwide. How is it transmitted? Dengue virus is transmitted by the Aedes mosquito. Some symptoms include fever, headache, myalgia, prostration, nausea, as well as orbital pain. A vaccine has been approved for use in some countries, but there are some serious concerns regarding its safety as well as its efficacy. Who is at risk? Many tropical populations are endemic to the dengue virus, such as countries in Asia as well as South America. Experimental background. This study aims to evaluate the spatial and temporal distribution of cases and their correlation to dengue virus throughout southern Brazil. Between August 2012 and September 2014, 878 patients with acute dengue symptoms were treated and evaluated at public health facilities throughout southern Brazil. The scope of the experiment was to consider the relationship between dengue virus and weather, as well as dengue virus and income. Molecular methods. Of the 878 patients with acute dengue virus syndrome, blood samples were obtained by venipuncture after written consent from the patients. Serum samples were collected from the patients and were tested for dengue infection using early ELISA testing. Samples that proved to be positive for non-structural protein as well as immunoglobulin M were considered as acute phase dengue virus. Molecular methods continued. Once samples were identified as acute phase dengue virus, they were selected for viral isolation. Of the 878 samples, 249 were considered positive for dengue virus infection. These cells were then isolated using virus strains from the patient's serum. This technique was done using the 80 cell line C6/36, and it is a resource for the detection, amplification, and analysis of mosquito-borne viruses, including Zika, chikungunya, as well as dengue. Dengue viral infections were isolated using the patient's serum from 145 of the 249 positive cases. Once the dengue virus was isolated, real-time PCR assay was used to identify dengue virus serotypes. Of the 145 that were successfully isolated, 140 serotypes were identified. Results and statistical significance. Of the 878 total symptomatic patients, only 249 were dengue virus positive. 629 were dengue virus negative, 170 were immunoglobulin G positive, of which 166 were collected up to 4 days after the first reported symptom. Dengue virus positive / immunoglobulin G negative were higher when compared to secondary dengue infection, or dengue virus positive immunoglobulin G positive. Dengue incidence was higher for immunoglobulin G positive patients, accounting for 43% of the 170 total when compared to immunoglobulin G negative, or 25% of the 708 total. Results and statistical significance. For starters, patients in lower income areas were affected most by dengue virus. Not only this, but hotter months from March to May of each year had the most cases. It also seemed that patients who had prior infections were most likely to be affected again. Conclusion. The aim of this study was to evaluate the demographic and serological characteristics of dengue patients in southern Brazil from 2012 to 2014, and to investigate dengue's occurrence with weather and to analyze its correlation with poverty. It was proven that not only did patients who lived in lower income areas, as well as during the hotter months, but during these times, and as well as these income statuses, we saw an increase in dengue virus cases, showing a positive correlation between dengue virus infections as well as low income and hotter weather. Relevance and future direction. Because there is no drug to treat dengue virus and there's only a vaccine that is approved in some countries, there is still a great concern for the control of dengue virus. There are rapid and expanding geographic distribution of the vector despite ongoing control efforts. There are speculations that this could be due to climate change, and not only that, but vector control through surveillance and prognostic approaches is essential to controlling epidemics, as well as reducing morbidity and mortality associated with dengue viral infections. This concludes my presentation.